Hi, my name is Heather, and I'm going to be the student provider today. And the topic of the conversation is going to be regarding the drug atorvastatin, which is often used in people with hyperlipidemia or high cholesterol. Atorvastatin is important in regulating cholesterol levels, and cholesterol is a waxy fat like substance that can be found in the cells of your body. Too much cholesterol can create plaque buildup, which is like a blockage, if you will, in vessels and arteries, and that can become dangerous and have severe complications. Torvastatin reduces the amount of bad cholesterol in your body by blocking the enzyme involved in the creation of cholesterol. It really is important in preventative healthcare because it reduces the risk of any cardiovascular illnesses. So let's dive into how atorvastatin works in the human body. The medication prevents an enzyme from creating cholesterol, which is how it works. And as a result of this process, less bad cholesterol is produced. The higher amount of bad cholesterol being produced, the higher risk a person is to developing a heart attack or a stroke. So the administration of atorvastatin helps lower the risks of those cardiovascular problems. So let's talk about how atorvastatin travels throughout the body now. After taking the medication, which can be either through tablets that you take orally or injections, atorvastatin is then quickly absorbed in the stomach and then it enters circulation throughout the body, beginning a trip through the bloodstream where it diffuses and starts its effects. The medicine is metabolized or broken down mostly by the liver, which contributes to the medication's increased effectiveness. The body then slowly eliminates the leftover chemicals in bile and that is produced by the liver. Bile is a greenish brown fluid that aids in digestion, and it does so because it breaks down fats that can be taken into the body by the digestive tract. A small amount, however, is excreted through urination. Even though atorvastatin is an effective medication or drug of choice for people with high cholesterol, and it provides a lot of benefits, it's important to know about the possible side effects of the medication. So, while most people react well to the medicine, a small percentage may have mild side effects like muscle pain, digestive issues, or occasional headaches. The side effects are usually temporary and disappear when the body becomes used to the medication, which can take around 6 weeks. So you want to make sure you're taking it every day consistently. It is necessary to understand that every person will react differently. Others may not have any negative effects at all, while others could. Your journey with atorvastatin includes regularly checking in, or regularly checking your health and telling myself or one of the other providers about any changes. Your health is important, and being educated helps you to take an active role in decisions that need to be made. So, if there are any unusual or new symptoms while you're taking atorvastatin, you want to contact the clinic and advise us of that immediately. Because other side effects like changes in sleeping patterns, liver function, and other digestive issues might not be noticeable. So, we want to make sure that ones you do notice are taken into account, recorded, and checked on to make sure they're not progressing into more serious issues. It's crucial to consider important aspects while considering the use of atorvastatin in different age groups, including pediatrics and geriatric populations. Pediatric populations' dosages are adjusted according to their age, weight, and unique medical condition. Doctors carefully change the dose to ensure the treatment safety and effectiveness of the drug to make sure that it is working correctly and it's not becoming toxic. We learned that monitoring is crucial to successfully observing and evaluating any changes that could occur and determining the medication's continued usefulness. So, when we monitor things, we want to make sure that you're not having side effects, you're not having any adverse or negative reactions to the medication, and that it is working the way that it should. The physiological reaction to drugs might change in older people, which must be acknowledged, meaning that older people tend to break down and excrete or eliminate drugs differently than those who are younger. As we age, those processes tend to slow down, so we hold on to the chemical breakdown of those medications a little bit longer. And because of that, continuously taking them can create toxic effect and have the reverse effect of what we're trying to do. Um, Healthcare providers such as myself should watch for any symptoms of pain or weakness in elderly patients, since they may be more susceptible to harmful muscle related um, conditions, mainly being a condition called rhabdomyolysis, which is a medical emergency. Um, Signs and symptoms of that are extreme muscle pain, aching, weakness, decreased urination, dehydration, or really dark colored urine. Those are kind of the key top indicators. If you're experiencing any of those at all, you need to contact the office immediately and go to your nearest emergency room for treatment. Um, these factors all demonstrate that customized approach to healthcare, which acknowledges the unique requirements of different age groups. The knowledge sharing that we're doing here aims to help patients better grasp providers' recommended therapies. The primary objective of our effort is to provide patients with knowledge so they may have informed conversations with their providers or other healthcare professionals. The function that medical staff play in healthcare management must be kept in mind because individuals may prioritize their well being during therapy by considering all of these criteria. So, to summarize, a solid understanding of the drug atorvastatin empowers people to take charge of their overall health. With the added knowledge, patients have a better way of having informative conversations with medical professionals and make choices about their overall health and well being. Recognizing the significance of one's health and the value of education in accomplishing health related objectives are both essential. I value your commitment to deepening your understanding of atorvastatin and the impact that it has on your body. If you have any questions or concerns, feel free to contact the office. I am here to support and guide you as you move toward improved health. Again, if you have any questions at all, I'm here for you.